Support for Radio Friends comes from Le Brunnery Financial, where they work to ensure a lifetime of financial security for people from all walks of life, from investment services to retirement plans. If you're looking for a trustworthy company that has the experience and knowledge to put your interests first, contact Le Brunnery Financial, a community-based investment counseling firm since 1966. Good morning and welcome to Radio Friends on this Monday, July the 26th. I want to introduce you to Dr. Satish Kalanjeri from the VA Hospital. Good to have you here, Doctor.
Nice seeing you again, Paul.
I did pronounce your name correctly, didn't I?
You were spot on.
Okay, Dr. Satish Kalanjeri. And you with the VA Hospital, as we said, but you wanted to talk today about some new asthma treatments and COPD. Explain what is the difference between asthma and COPD?
Well, COPD is a disease of the lungs that mainly affects those who have smoked for a long period of time. The damage that is done to the lungs and to the breathing tubes in the lungs are for most part irreversible. Now, this damage can be mitigated and ongoing damage can be stopped if those afflicted with COPD stop smoking.
You say, though, if you have COPD, the damage that you have is irreversible?
Yes.
But you can, if you stop smoking, you can prevent it from getting worse.
That is absolutely right.
There is a big difference then between COPD and asthma.
That is correct.
What is asthma?
Asthma mainly affects somewhat younger people, not always, somewhat younger people. Asthma is thought to be a condition where the breathing tubes narrow down, or what we call constrict, abnormally. And the question is why this happens, and there might be no reason for it, or in some instances what happens is these patients are susceptible to certain allergens, certain external factors that trigger the muscles that wrap around their breathing tubes to constrict more than usual.
Right.
And this causes an asthma attack. For most part, the asthma condition is reversible in that you can reverse these effects with medications, with inhalers, and so on. But if left untreated or if left uncontrolled, then over a period of time, the changes in the breathing tubes can become permanent.
Now, I had asthma when I was a young child. Then I wasn't bothered with it for a while. Then several years ago, it has come back. So I have asthma, but I have the rescue inhaler Albuterol, which I use, and that gets it under control immediately. Are there new treatments besides Albuterol for asthma?
Yes. There are several treatments for someone like you who has, from what I can gather, a mild form of asthma, something like Albuterol, which is a reliever. It relieves those muscles I was talking about, the muscles which wrap around the breathing tubes. Albuterol relieves them. And then for people who have a more severe form of this condition, there are other inhalers which can have long-lasting effects. And then there are some things called biological treatments, which are injections, which can also help with asthma. When all of these things fail, when someone's on all kinds of treatment, then in select patients, we can offer a certain procedure called bronchial thermoplasty.
What is that?
Now, this procedure consists of trying to reduce the thickness of the muscle that wraps around the breathing tubes.
Is that a surgical treatment?
Well, it is a procedure. It's not necessarily a surgery. What happens is we put patients to sleep, and then using a bronchoscope, which is a camera, which is a thin flexible tube with a camera at its end, we put them through the nose or the mouth into the breathing tubes, and then using a special catheter, deliver very controlled temperature, heat to the breathing tubes, such that the muscles around the breathing tubes get somewhat destroyed, in a controlled fashion, and over a period of time, the thickness of these muscles reduces, which means when an asthma attack is about to happen, these muscles do not go into an overdrive, so to say, and therefore they don't constrict the breathing tubes as much. So this bronchial thermoplasty procedure is reserved for those who have tried most other treatments and have failed. And we have noticed some pretty significant improvements in some of our patients who have received these treatments.
Yeah, and then some people, now my doctor was telling me about another type of medication that you would do just one time a day. It's an inhaler that you do once a day and it works all day long.
Is
that something new?
Newish, I'd say.
Is it like albuterol or is it different?
It is slightly different. Now, there is albuterol is what we call short-acting. When someone inhales albuterol, the effect lasts only a couple of hours or so. Then there are longer versions of albuterol, what are called long-acting inhalers. And then there are certain different kinds of inhalers which can be taken once a day, but the effect lasts the entire day.
If you have asthma, and you're keeping it under control with the albuterol or the other inhalers, can it get worse or can it just go away? Like mine, when I was younger, it disappeared for a long time. Can it just go away too?
It can. It absolutely can, because we don't quite exactly know what triggers asthma. Now, sometimes we can identify the triggers. Often what happens is either because of a person's what we call physiology, over time the body adapts and is not as responsive to these triggers, and it can quote-unquote go away, or people grow out of asthma, as they say.
Or you can grow back into it again.
Or they can go back into it again. It all depends on external factors and what can trigger this condition.
Yeah. If people can this be a life-threatening, can asthma and COPD, it can be life-threatening, can it, if you don't control it?
It absolutely can be. The reason is there is something called an acute flare, or a severe attack can occur out of the blue, and therefore it is very important that we keep these symptoms under control, and if we identify triggers which can precipitate these conditions, it's very important to avoid those conditions, because once there's an acute attack, I'd say all bets are off and it can be life-threatening.
Okay. If you want more information, where can they go?
Well, they can look into medical societies. They can look into call the Truman VA or the University Hospital. They can get more information.
Okay.
There's a lot of information. What I'd suggest is when you seek information, seek it from sources that are reliable, medical societies and so on, okay, and avoid resources that do not offer scientifically backed information.
Doctor, thank you so much. Dr. Satish Kalanjeri from the VA Hospital. I appreciate visiting with you. Please come back again.
Thank you, Paul. It's a pleasure.
All right. We're out of time for today. Something you'd like to hear or see? I want to hear from you. Pepper P, Missouri.edu. Have yourself a nice day. Bye-bye.